We're nearing the end of October, but it's not too late to talk about breast cancer. We can talk about that the whole year, but you know what? On the Morning Fix, on the Hot Takes, we like to bring in issues that are relevant, and that's why today Bhargav and I aren't alone. We have Dr. Miriam Mutebi, who is a breast surgical oncologist, and she's also an assistant professor in the Department of Surgery at the Aga Khan University Hospital, of course, here in Nairobi. Good morning, Dr. Mutebi.
Morning. Happy to be here. And as you said, we really shouldn't wait for October. We can talk about it the entire year, but happy to be here.
Exactly. Before we jump into questions specifically about breast cancer, I just want to ask you a little bit about yourself, about your practice. Maybe you can tell us about your journey becoming an oncologist.
Oh, I would say it's rather long because you definitely initially have to do your first medical degree and then do general surgery and then do a breast surgical oncology fellowship. So at some point I used to write, occupation student, because it feels like you're permanently in school, right? And then after that, I'm also my other hat is that I'm a clinical epidemiologist and health systems researcher. And so basically my research focus is on understanding barriers to access for women who have cancers in our region, and then trying to design interventions that try and mitigate those barriers.
Oh, wow.
Wow,
Yeah.
that is very impressive. And I must say, you look really, really good wearing pink scrubs as well. I didn't even know you could get scrubs in pink.
Well, rock it. It is breast cancer awareness, so every little bit helps. And sometimes you're just going to OR with the scrubs, and patients are like really chuffed, and they're like, "Oh my God, this is so exciting!" I mean, I'm so happy that you're wearing your pink scrubs. I'm like, "Yes, we're going to do this. We're going to conquer this." So I think it's important to keep up the hope.
True that.
great.
Now, we're talking about breast cancer. So I have a question already. We could start off with the questions now. Who should be particularly worried about breast cancer? Women over a certain age, or someone who has a history in the family in the past, or any other kind of things that they need to be aware of that they might just contract this?
I think that good question. I always say, Radhika and Bhargav, if you want to know who is at risk for breast cancer, we do what we call the mirror test.
Mirror?
The mirror test. Basically, hold up a mirror.
Oh, everyone.
Everyone is at risk. Now,
men, women.
exactly. Now, that risk may differ slightly for a couple of reasons, and we'll probably go into that. One, if you're female, then that automatically increases your risk for getting breast cancer. Of course, age is a risk factor. The older you get, the more likely you are to get breast cancer. But again, if we look at the scenario that we see specifically in our region, we see that our patients are diagnosed 10 to 15 years younger than populations in the West. So according to our national data, our average age of diagnosis is around 48. And the range
Wow.
being from 45 to 55. And that's why even in terms of our national screening guidelines, we've modified those to reflect the population that we're seeing. And from a clinical perspective, we're definitely seeing women in their 30s, women in their 40s, women in their 20s as well, who are getting diagnosed. So I think the message is that we're all at risk. Let's not ignore stuff. Yes, a family history may predispose one to, may give you a slightly higher risk of breast cancer. We're probably all aware of Angelina Jolie and, her diagnosis. In her case, her family has a strong family history, meaning she has 2 or more first degree relatives. Her aunt, her mom had breast cancer. I think her aunt had ovarian cancer, and she had genetic testing done for that. And they picked up this, what they call a BRCA gene, which basically stands for breast cancer gene. And that was positive for her. And so when you have that particular gene, your risk is almost about, I would say, 10 times higher than the average.
Can you check if you have this gene?
No. What happens is you would need to have like a blood test or a saliva test. But keep in mind, that is only 10% of breast cancers.
Okay.
90% of breast cancers are what you call sporadic, meaning you can't find a reason. And people, sometimes people get very comfortable. They say, listen, I don't have anyone in my family who's had a cancer, so I'm good. No, we're saying 90% of the time you will not have a family history. And so we're all at risk, and that's why it's important, regularly get checked and go for screening.
And is there any reason that women in our region are contracting breast cancer earlier? You had mentioned that the age seems to be younger.
Yeah.
Is there a cause, or is it just statistics?
Well, of course, one would argue that if you sort of age adjust, meaning you do these big complex statistical models and try and apply them and match them to countries in developing countries, then we will sort of see a similar curve. But I would say nobody still knows the answers. Studies are ongoing. Right now, we're part of a multi-center study trying to look at the genomics of our breast cancer, because we're definitely seeing, I would say, an entirely different disease. When we were in school, we were told breast cancer is a disease of your 60s and 70s, and things that would be traditionally protective. What would sort of give you, at least decrease your risk, which is, having your first baby before 30 years of age, having multiple children, having, breastfed, traditionally would all sort of decrease your risk for cancer. But we look at our patient profile, and these are all young women, all, maybe probably had the babies young, have all breastfed, and they're still getting cancer. So nobody quite
it's
knows.
Not the textbook definition of what you'd
exactly.
expect.
All the myths that were there, that it's only at a certain age, the way you said that you get. That was a myth.
Exactly.
But you're seeing people getting even at a younger age.
You know what? We actually want to dive into the myths, and we'll be dispelling them. We'll be talking about men and breast cancer as well. So I suggest you keep it tight here on Radio 44. Follow my simple instruction. Every year we're encouraged to get breast cancer screening, and you're actually meant to do it more often than just once a year. But you know what? Sometimes there seems to be a lot of stigma around breast cancer in particular. Some women might feel it awkward or embarrassing to go get screened or checked. Dr. Mutebi, could you please shed light if you've seen this with some of your patients and how we can overcome it?
Thanks, Radhika, and please call me Miriam. I'm always say Dr. Mutebi. I tense up. I'm like,
Doctor mode.
Do I need to give a diagnosis? No, but we there's quite a lot of I would say fear and uncertainty, especially around our health-seeking behavior, and quite a number of people say, why am I going to look for trouble? Like, why would I go in for screening? Like, why am I just going to find something that I didn't know I had? And we're saying, paradoxically, especially with breast cancers, you catch them early, you treat them appropriately. Not only are they treatable, they're actually curable. And so we're saying, paradoxically, you do want to go and find things early that you may not know you had. And for instance, with screening like the mammography, the whole rationale is it's able to detect or pick up lumps that you're not necessarily able to feel. For you to feel a lump, it needs to be at least 1 centimeter.
Yeah.
And so the mammography is able to pick up lumps that you're not necessarily able to feel. And that's what we're saying. You might not necessarily feel it, but you may still have something. And that's why it's important to go for the regular screening.
And this is both men and women, right?
So in terms of the screenings primarily focused around women, just because they're at higher risk for getting breast cancer. But what we try and tell patients is the whole concept of breast awareness. So breast awareness involves, just knowing, your breast, having an appreciation of what's normal, what doesn't feel normal. And this is where the self-breast exam comes in. And just because and all of us, as I said earlier, are at risk. And so it's important to know, first of all, that there's a lot of other things that can present like a cancer but are not necessarily a cancer, and it's important to get those checked out. For instance, 9 out of 10 lumps are not a cancer, right? But everyone gets a lump and you're automatically thinking, OMG, this is going to be a cancer. We're like, no, there's 9 other things it could be, but we do need to you do need to get it seen by a health professional, and you do need to get it checked out. Now, as far as male breast cancer is concerned, it is not as common. It's maybe, I would say, 1 to 3% of all breast cancers. However, there are also other breast conditions that that do affect men, and they are important to get addressed. You could have things like what we call gynecomastia, which is just a big fancy name to say an enlargement of breast, and sometimes it could be just hormone related. Sometimes you put on a bit of weight and you're like, oops, you've gone up a size or something. But by the time you're getting to wearing a double D and you're a man, you definitely do need to get it checked out, because there might be something else that's going on there that may need medical attention. And so that's why we're saying it's important to actually not ignore things. Get yourself checked. Have a sense of what is normal for you, and you can only know that if you're regularly doing it. And so, as part of the breast awareness and self-breast exam, we say 3 simple tenets: look, move, and feel. So, looking in the mirror, looking to see, is there any differences? Is there any bumps that you're seeing? Any skin changes? Sometimes you don't actually need to feel a lump, right? Sometimes just the alteration of the skin, a slight swelling, may indicate that something else is going on. Sometimes you may have a discharge that's coming out, and we say it's very critical to sort of distinguish between what we call a discharge versus a secretion. Mm-hmm. Now, a discharge is what comes out on its own. Mm-hmm. And a secretion is pretty much what you go looking for, so to speak, because some people get anxious and they try and check and see if there's something coming out. Paradoxically, the more you check, the more stuff comes out, because you kind of send signals to your brain that supplies are required, and they're like, what's going on, kind of thing.
So you trick your body into giving you false signals.
Exactly. So we say what's concerning to us is a discharge, so meaning it comes out on its own. Usually, especially if it's so what we call spontaneous, and more concerning if it's just on the one side, like what we call unilateral, and also the nature of the discharge. You may find it's bloody. Sometimes you may, you wake up, you find either your bra, your night dress is stained, or that kind of thing. So those are the kind of discharges that we're worried about. Right. Sometimes you may get bilateral discharges, meaning just fluid coming out for whichever reason, and it can happen just what you call physiologically. Yes. Sometimes it can happen in older ladies, but it is important, as you said, any new symptom, any new sign, just get it checked out. Don't ignore it. Don't assume it's something normal. Yeah. But having said that, most of the time it is something normal. But let's have the assurance of your health position.
Correct. It's always good to know rather than just assuming.
Exactly.
So that's similarly for the myths, right? Radhika already mentioned that men generally are not aware of probably getting breast cancer. They generally feel, no, this is just related to women, and you brought out that 1 to 3% it's a very minute number, but it's still there.
Sure.
What are the other myths that people don't or think about breast cancer, but it's not true at all?
I would say, of course, talking about bras and things, people get I think bras have gotten a bit of a bad reputation because one of the myths we hear is that, underwire bras cause breast cancer, right? And we're like, no, you're just, it's like saying your shirt, caused my cancer. It doesn't have anything to do with what you're wearing. And sometimes, because some people will put money inside their bras or their cell phones at the market. So there also that some people think that may have caused their cancer, and we say, listen, this is all external. It doesn't have anything to do with what you're what's going on in your system. It's rather an external garment like anything else, so it doesn't necessarily cause you cancer.
Well, there you go. Your underwire bra isn't causing you cancer, nor is the money that you're stuffing in your bra. I wish I had that problem. But anyway, and now dispel some myths.
Yes, talking about myths, there are 2 more that I want to ask you. Some people say underarm deodorant is also causing cancer, right? And then the other one is where breast cancer is not so life-threatening. This one just got breast cancer. It's just breast cancer. It's not, oh my God, it's breast cancer.
Thanks. I think for sure there has underarm deos are getting a bit of a bad rap, and unfortunately what one would say, there's quite a bit of misinformation out there. However, as far as the body of evidence and science has been concerned, there isn't any link between breast cancer and the underarm deodorants.
So
Now-
please be using deos.
I was about to say, my brother, if you're listening, please, now is the time. Throw the natural one. It doesn't work.
No, I mean, they do contain aluminum compounds, and some people say, you know what, despite them not, causing cancer, I don't want any chemicals, in my temple or on my whatever. And we say you can definitely try the natural methods as witch hazel. Some people use dilute vinegar, some people use dilute lemon. But we say, please be kind to your co-workers. There's really no good reason for you not to use any of these methods because they do not cause breast cancer. Then as far as the life-threatening, any cancer is potentially, I think the mix is somewhere in the middle. I mean, because any cancer is potentially life-threatening, but I think it's also important to know that it is curable. And if caught early, managed appropriately, it is definitely curable. And I think that's what we need to emphasize. I mean, definitely treat it with the gravity that it deserves, but also recognize that there's hope. And for anywhere else in the world where it's caught early, managed appropriately, breast cancer is just another, chronic illness. You come in, you get your treatment, maybe for 3-4 years, 5 years. You graduate into the survivorship program and you get on with your life and everything else that's going on.
So you mentioned early detection. Can you just list the treatments that you can use in the early stages that really help you go into the survivorship and etc.?
Yeah. So the mainstay of early breast cancers is surgery. And surgery could be either just removing the entire breast, what we call a mastectomy, or it could be what we call breast conservation therapy, where you remove just the lump. And so you don't necessarily need to lose your entire breast. If we are going to have the lumpectomy, just meaning the removing just the area that has the cancer, then you absolutely need to have radiotherapy. So it's lumpectomy plus radiotherapy in comparison to mastectomy, and the outcomes are similar for early breast cancers. So what we tell ladies is if you come in early, it gets detected in time, you don't necessarily need to lose your breast. We can definitely preserve your breast.
I love it. So the message is clearly, if you catch it early, the treatment is easier to go through with and it's more likely to be successful. Now we'll have some more information on how you can test early. We'll be talking about that in the third hour, but I just want to say a very big thank you to Dr. Miriam. Thank you so much. We know your schedule is packed, especially in October, but you've been of great help, and you've really educated both Bhargav and I, and I'm sure the audience as well. So thank you so much.
Yeah. Thank you so much for having me. I think it's been a blast. I think I would tell everyone, let's not ignore our health. Take charge. We are just partners in your health, and we're trying to give you the tools to, take charge of your life. So, go out there, be aware of your breaths, and get screened. Thank you.